Top 12 Cancer Myths versus Facts. Debunking Common Misconceptions. Cancer is a complex and often misunderstood disease that affects millions of people around the world. With over 200 different types, it can be challenging to keep up with the latest research and information about cancer. Unfortunately, many misconceptions and myths about cancer still persist, leading to confusion and fear among the general public. These misconceptions can prevent people from seeking proper diagnosis and treatment, and also contribute to the stigma surrounding this disease. In this video, we will debunk the top 12 cancer myths and provide accurate, science-based information to help you better understand this condition. By separating fact from fiction, we hope to empower individuals to make informed decisions and dispel any misinformation about cancer. So let's dive into the truth behind some of the most common cancer myths and misconceptions, and learn how we can all play a role in raising awareness and promoting accurate understanding of this widespread illness. Just a quick reminder, we are not doctors. This video is for informational purposes only. 1. A cancer diagnosis means the end of life. It's a common misconception that a cancer diagnosis equates to a death sentence. In reality, survival rates have significantly increased over the years, and cancer is no longer synonymous with a fatal outcome. Over the past 25 years, the cancer death rate in the U.S. has decreased by 27%. For certain types of cancer, such as thyroid, breast, and prostate, the 5-year survival rate is currently an impressive 90%. This increase in survival rates can be attributed to various factors. Among them, a reduction in smoking rates has played a significant role, given its well-established link to various forms of cancer. Additionally, advancements in medical technology have facilitated early detection and treatment, drastically improving patients' prognosis. Furthermore, the type of treatment available and the extent to which the cancer has spread can also influence survival rates. Therefore, while a cancer diagnosis is serious, it should not be seen as an automatic end-of-life sentence. 2. Cancer is contagious. Dispelling the myth, cancer is not a contagious disease and cannot be spread from person to person through any form of contact. Unlike infectious diseases that can be transmitted through air, bodily fluids, or physical contact, cancer is the result of one's cells growing out of control, which is strictly an internal process. That said, there are certain viruses like human papillomavirus, HPV, and hepatitis B and C, which can be transmitted through intimate contact and can increase the risk of developing certain types of cancer, such as cervical and liver cancer. In these cases, it's the virus that is contagious, not the cancer itself. Intriguingly, some animal species like Tasmanian devils and dogs have been known to contract transmissible forms of cancer. But this phenomenon is exceptionally rare and does not apply to humans. 3. Cutting sugar will cure cancer. Contrary to popular belief, simply cutting out sugar from your diet will not cure cancer. The misconception likely originates from the fact that cancer cells tend to consume more glucose, a type of sugar, than normal cells. However, it is important to understand that while reducing or eliminating sugar from your diet can help maintain a healthy lifestyle, it does not directly lead to the elimination of cancer cells. High sugar intake has been linked to obesity, which in turn increases the risk of developing certain types of cancer. However, this is far from suggesting that sugar directly feeds cancer cells or that cutting it out can starve these cells. It is essential to note that a balanced diet is just one aspect of a healthy lifestyle that can reduce the risk of developing cancer. So, while cutting down on sugar can have numerous health benefits, it is not a guaranteed cure for cancer. 4. Cell phones cause cancer. One of the most persistent myths is that using cell phones can lead to cancer. This concern likely stems from the fact that cell phones emit radio frequency radiation, radio waves, a type of non-ionizing radiation. It's important to note that while the human body does absorb this radiation, it's different from ionizing radiation, which we know increases the risk of cancer. Non-ionizing radiation, on the other hand, is not known to increase cancer risk. The National Cancer Institute states that despite numerous studies into the potential health effects of non-ionizing radiation from various sources, including cell phones, there is currently no consistent evidence that it raises the risk of cancer in humans. So while it's always wise to use technology mindfully, the claim that cell phones cause cancer remains unsupported by scientific evidence. 5. A biopsy or surgery will cause cancer to spread. This misconception is not only false but potentially harmful, as it might discourage people from seeking crucial early diagnosis and treatment. The belief that cancer can spread when exposed to air or disturbed by a needle during a biopsy or surgery has no scientific backing. Surgical procedures don't cause cancer to spread throughout the body. Surgeons employ meticulous techniques and precautions to minimize the risk of any cancer cells spreading during surgical procedures. A biopsy, which involves extracting a small sample of tissue for testing, is a critical tool in diagnosing cancer and doesn't cause it to spread. Therefore, it's essential not to let unfounded fears deter you from getting necessary medical procedures. 6. Herbal medicines can cure cancer. There's a prevailing myth that herbal medicines can cure cancer. However, there's no scientific evidence to support this claim. Some individuals may find that certain alternative therapies, such as acupuncture, meditation, and yoga, can help alleviate the psychological stress associated with cancer and manage some side effects of cancer treatment. Yet this doesn't mean these approaches can cure or treat the disease itself. The National Cancer Institute cautions that labeling something as natural doesn't automatically make it safe. There are instances where herbal supplements can have adverse effects on health. For example, studies had indicated that kava, an herb often used for stress and anxiety, could potentially lead to liver damage. Similarly, street John's wort, used for depression, may interfere with the effectiveness of certain cancer drugs. 7. Cancer is a modern disease created by humans. Contrary to this belief, cancer is not a man-made, modern disease. In fact, it has been a part of the natural world for much longer than most people realize. Paleontologists have discovered evidence of cancer in dinosaur bones and even in a 240-million-year-old turtle ancestor. These findings provide definitive proof that cancer existed millions of years before the dawn of modern human civilization. While it is true that certain lifestyle factors prevalent in the modern world, such as smoking and unhealthy diets, can increase the risk of developing cancer, these are not the sole causes of this disease. It's worth noting that advancements in diagnostic technology and longer life expectancies might contribute to the perception that cancer is more common today. However, this doesn't imply that cancer is a modern man-made disease. Rather, it suggests that we've become better at detecting it and living longer lives, which increases the chance of developing the disease. 8. Cancer always comes back. The notion that cancer always comes back is a myth, according to Dr. Colin Vu, a medical oncologist and hematologist. The reality is, treatments are continually improving and entirely eradicating cancer is increasingly possible. However, the complexity lies in the variance among cancer types. Each type has a unique potential for being cured and distinct timelines for recurrence. As scientific progress continues to advance treatments and as awareness of cancer risks and early diagnosis improves, the misconception that cancer always comes back may further dissolve. 9. No family history of cancer means you're not at risk. Contrary to common belief, not having a family history of cancer does not necessarily imply that one is not at risk. It's crucial to understand that while genetic predisposition can play a role in some types of cancer, it accounts for only about 5% to 10% of all cases. The majority of cancers are actually attributed to genetic mutations that occur due to environmental factors and lifestyle choices, such as tobacco use, diet, and exposure to harmful substances. So even if there's no cancer in your family, poor lifestyle habits and exposure to carcinogens could still potentially increase your cancer risk. Additionally, factors like aging can contribute to the risk, considering that most cancers occur in older adults. 10. Certain cosmetics cause cancer. While many believe that products like deodorants and hair dyes, due to their proximity to vital organs and use of strong chemicals, can cause cancer, scientific evidence contradicts this myth. Studies showed no indication that chemicals in deodorants or antiperspirants lead to cellular changes in breast tissue. Similarly, personal use of hair dye has not been proven to elevate cancer risk. Although it's essential to be aware of product ingredients, it's equally important not to let unfounded fears overshadow the facts. 11. Superfoods can stop cancer. While it's true that a nutritious diet can enhance overall health, the notion that superfoods can halt cancer is a myth. These nutrient-rich foods, like fruits and vegetables, play a key role in maintaining a healthy lifestyle and reducing obesity, which is a risk factor for certain types of cancer. However, superfoods should not be viewed as a miracle cure. Instead, they should be incorporated as part of a balanced diet to support overall health and wellness. 12. Artificial sweeteners cause cancer. Contrary to popular belief, there is no strong evidence linking artificial sweeteners to an increased risk of cancer. Initial concerns arose from early studies showing that cyclamate, when combined with saccharin, led to bladder cancer in laboratory animals. However, further research, including a study with data from over 500,000 participants, found no clear association between artificial sweeteners and cancer in humans. Thus, while it's essential to consume artificial sweeteners in moderation as part of a balanced diet, fears of these products causing cancer remain unsupported by scientific evidence. Understanding cancer involves separating myths from facts. With awareness and knowledge, we can dispel misconceptions, encourage early detection and treatment, and reduce the fear and stigma associated with cancer. Keep in mind, though, we are not doctors, and this information should not be considered as medical advice. This video is for informational purposes only. If you found this video interesting, I invite you to subscribe and check out our video on spotting lung cancer early. 12 warning signs you should know.